Hi guys, it's Erica. I have cystic fibrosis. I'm a wife, I'm a mom, and today I'm doing my port change. I've just taken the needle out and I'm going to show you guys putting the needle back in. So this part's way more particular than taking it out, because taking it out you just remove the sticker, remove the needle, just make sure it's flushed significantly, make sure you have drawback before you actually take the needle out, so that you know that it was working before you took the needle out. Okay, so what I'm going to do is I'm going to build my sterile field. So this is going to be my sterile field that's going to sit on top of my clean paper towel, and nothing that isn't sterile can go on this. So I can't touch, nothing that's been touched by anything else can touch this area. So just bear with me, it takes a minute. Alright, so we've opened the sterile field. These are our sterile gloves. We don't touch those until we're going to put this on and clean it. So we've got our sterile needle. I've got a power port, so this is a 19 gauge. I'm going to empty out my 4" by 4 3/4 inch, sorry, 10 centimeters by 12 centimeter patch that goes over the needle. It's like a clear bandage basically. And then my little connector. Okay. Flushes. Another saline flush here. And you know what? Screw it. We're going to do 3 saline flushes, because you just never know. And it's better to have too many than not enough on your sterile field here. Okay. And then I'm going to take a heparin as well. And I've just ruined that because I touched it. I'm going to go grab another one, sorry. Not actually ruined it, I'll be able to use it later. I just can't drop it on a sterile field. Alright, so shit. There. Okay, so we've got the needle, the connector, the flushes, the patch. Alright, now we need to do the alcohol swabs. So I'm extremely allergic to chlorhexidine, so I can't actually use the chlorhexidine properly to clean. So I just use the swabs, like these gauze pads, and then I put rubbing alcohol on them. Like a nice amount. Another rubbing alcohol pad. Another rubbing alcohol pad. Okay, so I'm pretty sure I've got everything. So now I'm going to take these gloves off because they're donezo. Sanitize. I'm going to adjust my mask because it's a little comfortable in my eyes. Okay. So now I'm going to grab the gloves out the sterile field, the carefulest that I can, because you can only touch the inside of them, you can't touch the outside. Okay, so there's one. You see how it is? So I see where the thumb is. I'm going to shove my hand in there. It's not a race, so however long it takes you to struggle to get them on, it's however long it takes you. Okay, and then I'm going to touch this one. Alright, good enough for me. Okay, now I'm going to start the cleaning. Nice circular motions. Open it up. Clean nice and around all the area. Okay. Alright, the reason I cleaned it first, instead of setting up the needles and stuff first, is because my skin has a reaction if it's still wet around the area with the tape, and then it ends up creating this like almost cut around the tape. It's wild. I usually don't always use tape, but you should. Okay, so I'm going to take this connector off my needle. This little guy, I'm going to take this connector off him. And this piece goes into this piece. Nice and tight. Okay? So there's still a protective little guy on the needle right now. And then I'm going to prime this tube. This is extremely important. You have to prime this tube before, because you don't want this much air going into your body. So I might come up a little closer. So you should be able to see the saline come out of this. Okay, so the tube's primed. So I'm going to cap it off. Okay, so this guy's ready to be put in to my body. Alright, so now comes the tough part, actually putting it into your body. Okay, so I'm going to come closer. Okay, it's pretty much dry. I'm going to remove this little tube. That's what the needle looks like. And then I'm going to, you should be able to see 3 dots. I don't know if you can see my dots. Yeah. So there's 1, 2, 3. You want to get it right in the middle of those 3. So right now it's like a triangle. I'm holding it steady. You can see there. See the 3? So wherever it sits neatly, you're going to try to get it right in the middle. And just once you're in, push down. Okay. Okay. And now we're going to see if we got it in the right spot. Yep. Full of blood. All right, I'm gonna flush this one more time here. Okay, and then I'm gonna heparin it. Okay, this whole baby goes right in. All right, and you're gonna wanna put a little back pressure in the line by closing it. So it should be closed. All right, everything's good. And now from here, there's this little adapter thing that just helps you hold it. It does nothing. You just take that off. Okay, that's it. And now the part I hate the most in the world, trying to put this sticker on without ruining the whole sticker. I'm actually terrible at it. Just the worst, really. Okay, here we go, guys. Just kind of flatten it out best you can. Yeah, I'm honestly the worst at putting these on. There was like a whole 3 months I didn't even use these. It's extremely not recommended to do that because everything's got to be sterile, everything's got to be proper. Sealed and such. Is this pretty? No. Is it sealed? Yes. So whatever. That's as good as that's gonna get for me. And that's it. And now I'll go hook up to my meds and stuff and be done with it. Clean up all of my mess. And that is how I ratchetly changed my port needle. Maybe I'll talk about it a bit. Yeah, I'll talk about it. So, while I'm cleaning up. So, it's super nerve-wracking. It can be really scary. So for the first few months I had like a home care person come in and do it for me, and then I had a guy stick me with the same needle like 7 times, thinking that, I'm not sure what his thought process was, but I guess he was thinking that maybe he put it in the wrong spot or something, but there was just so when the tubing goes in, sometimes little flaps of skin grow on the bottom of the tubing, and then you need to have like a clot buster put into your line to break up the clot or whatever, and that can take like an hour or 2 for it to actually work. So the guy kept on trying, and when you pull back, let me see, when you pull back on one of these syringes when it's attached to your tubing, if you don't get drawback, it's almost like a suction. There's like a suction and nothing comes out, and there's no blood that goes into the tube, and that's what kept happening. And instead of being like, okay, you need to go to the hospital and get some clot buster put in there, he kept on shoving the needle in and out, and new needles each time, this exact process like 7 times before I was like, I was brand new to this. I figure people know what they're doing. After the 7th time, I was like, no, there's no more doing this. I'm going to the hospital. The guy put it back in once and was like, nope. Like, I believe his name was Adam. He's actually awesome. He's like a port nurse there at St. Mike's. And he just put some clot buster in. And he basically said as long as things are still going in and you're not getting like swelling around the area, because if it's swelling, that means it's just going into your skin. It's not actually going into the port. So I went home. It wasn't really working. I flushed it maybe 7 to 9 of these, and then it started working again after clot buster. So the moral of the story is, after that, I was like, there's no way in hell anyone is ever touching this port again unless I'm unconscious. So I got the clinic nurse, like a CF nurse in my clinic to teach me. I got a new home care lady to teach me how to do it. And I also got all of the knowledge that I would need to know about port care from a port care nurse in the emergency. So like I may not know how to explain it in the best way, but I've since then, knock on wood, I've never had problems switching between medications. I give it a good two of these and a heparin two of these and a heparin when I'm not hooked up to meds anymore, just so that this line is always staying fresh and clean. Yeah, they're not just going to teach you how to do it. You need to really harass them about it. Like, you need to, whoever is doing it for you, you need to pay attention, and you need to say, I want to learn. You need to tell them that your end goal is to be kind of like self-sufficient. So now I know, like, whenever I go to the hospital and I'm really not doing well, like, I'll have this ready so that I don't have to wait hours for my port care nurse to come in the hospital and access it. I can just have it accessed when I go in. So that's basically all I have to say about this. It's the best thing that I've ever done for myself, not having to have PICC lines anymore. If you've ever had a PICC line get infected, you know how disgusting that can be, how painful it can be. So if you are a candidate for this, I would recommend it, especially if you're getting IVs all the time. If you have cystic fibrosis, you know what I'm talking about. Like, once you're past 20, you're pretty much, I hate to say it, but from 20 to 25 is probably around the time you start to decline, if you are not already. I mean, I had never even been hospitalized until I was like, I think I was like 26. I've never even stayed overnight in a hospital other than when I had my baby. So when the decline starts happening, it happens kind of fast. So it's kind of super shitty to say, but like I would suggest that anyone who is regularly hospitalized, regularly getting PICC lines, you do this once and it's good for like 15 years as long as you take care of it. It does depend on how well you take care of it, how well it was placed. Everybody's body's different, like how much you use it. But yeah, it's going strong for me so far. I had a CT scan and he's like, wow, where did you get your port done? I was like, oh, it's a power port. I got it done here. He's like, that's the quickest I've ever seen that gel, like that dye go into a person. Like, it was awesome. Like, I had no problems. And I was like, ah, sweet, because like it really felt weird. And I don't know if you ever had a CT scan, but it kind of makes you feel like really warm sensation, like you have to pee or something. But that was also my first time ever having one of those. So I guess being diagnosed really late in life saved me from a lot of bullshit. Like, some of the people that I've been talking to, they've been being poked and prodded since they came out. So I'm sure, like, if I had been diagnosed, I would have probably gone through so much more bullshit. So I'm just like blessed that I was thriving for at least 20 years of my life. I didn't get diagnosed till I was 15. But I would suggest that anyone who gets PICC lines all the time, if you're getting sick more than 3 times a year and having IVs, this baby. Anyway, don't ever take anything that I say as medical advice, because I have no license. I do my own medical care, trained by nurses and stuff to do it for myself, not to do it for any other person. It's just for me. So if you're interested in doing your own care, just talk to your team. I'm sure, like, probably out of 10 people, 8.5 want you to do it yourself anyway. So, with CF, it seems like our community is very inclusive, very, everybody wants to help everybody. We all share knowledge. So if you want to learn how to do it, or you want your family members to learn how to do it, just ask. And I know in Canada, you for sure shall receive. So, I've been talking for a long time. I'm going to go. Also, I think my cat smashed something a while ago. But anyway, so this is my port. This is how it turned out. Flush is fine. We're good. All right, bye guys.